Hello and welcome to Perspectives on PH. I'm Steve Highsmith. PAH.TV brings you up-to-date coverage of the latest news and information on pulmonary hypertension research and clinical practice. We recently spoke on the phone with Dr. Nick Kim from the University of California, San Diego for a clinical update of Phase 3 studies on Riociguat. I asked Dr. Kim a series of questions about how this data, recently reported in the New England Journal of Medicine, may impact the treatment of patients with PAH. First, we asked him to describe the mechanism of action of Riociguat and what makes it different from PDE5 inhibitors.
Riociguat belongs to a new member of drugs called soluble guanylate cyclase stimulators. And this drug has a dual mode of action. It has both a NO-dependent pathway, like the phosphodiesterase 5 inhibitors that we currently have, but it also has an NO-independent pathway of directly stimulating soluble guanylate cyclase, which then augments and increases cyclic GMP. Riociguat has the advantage over PDE5 inhibitors by having a dual mode of action. PDE5 inhibitors requires endogenous nitric oxide to stimulate SGC, which then increases cyclic GMP. With Riociguat, not only does it improve the interaction of nitric oxide to SGC, but it can also directly stimulate SGC in cases of NO depletion, which is a concern in pulmonary hypertension. So therefore, this drug can work without endogenous nitric oxide to ultimately increase cyclic GMP.
I then asked Dr. Kim to discuss the overall clinical program for Riociguat.
Riociguat has been studied in preclinical as well as early phase 1 and 2 trials. It has revealed overall tolerability and safety in these early trials. And furthermore, in the phase 2 trials, this drug showed clinical improvements both in exercise capacity and hemodynamics in patients with pulmonary arterial hypertension and inoperable chronic thromboembolic pulmonary hypertension.
Dr. Kim reviewed the design for Patent 1.
Patent 1 was a 12-week prospective, randomized, double-blinded, placebo-controlled, multi-center study looking at Riociguat in pulmonary arterial hypertension. The primary endpoint was change in 6-minute walk distance at 12 weeks compared to baseline. The secondary endpoints included changes in pulmonary vascular resistance, biomarker, namely NT-proBNP, change in WHO functional class, time to clinical worsening, Borg dyspnea scale, as well as 2 measures of quality of life. The patient population studied included symptomatic pulmonary arterial hypertension, including the subgroups shown in this slide. They also had to have a entry pulmonary vascular resistance greater than 300 dynes seconds centimeter minus fifth. They have to have, by definition, mean pulmonary artery pressure at least 25 millimeters of mercury, and a 6-minute walk distance at baseline between 150 to 450 meters.
I then asked Dr. Kim to describe how Riociguat was dosed in this study.
This study included 3 randomized arms. Riociguat up to 2.5 milligram 3 times a day as the maximum dose. There was a placebo group as well as a fixed dose of 1.5 milligram 3 times a day. And the randomization occurred 4 to 2 to 1 respectively. All patients started with 1 milligram 3 times a day, and the dose was increased by 0.5 milligrams every 2 weeks, depending on systemic blood pressure and symptoms related to hypotension. As you can see in this slide of dosing, 75% of patients achieved the maximum 2.5 milligram 3 times a day in the individual dose titration group. 15% achieved 2.0 milligram 3 times a day, and 6% only achieved 1.5 milligram 3 times a day. 12% required dose reduction, and in the fixed dose 1.5 milligram arm, 96% of them achieved the full strength of 1.5 milligram 3 times a day.
He went on to describe which patient types were enrolled.
This study only enrolled patients in WHO Group 1, or pulmonary arterial hypertension. As you can see from this slide, as with other pulmonary arterial hypertension studies, majority are represented by the idiopathic group, but there were representation from other associated conditions such as connective tissue disease, congenital heart disease, and so on. These patients were allowed to be on background pulmonary arterial hypertension therapy, and as you can see, roughly half of the patients enrolled in this study were on background therapy, most commonly with ERA, but also a smaller degree had prostacyclin as their background therapy. Of note, these are non-IV parenteral prostacyclin therapies.
We asked Dr. Kim to review the study findings.
The primary endpoint was met with a statistically significant difference in 6-minute walk distance measured at 12 weeks. This slide shows both the observed and the imputed values, showing that the Riociguat treated patients had a treatment effect of roughly 36 meters in favor of treatment with Riociguat compared to placebo at 12 weeks. Additional secondary endpoints were also met and were highly statistically significant, including in a hierarchical order, the pulmonary vascular resistance was significantly reduced in the Riociguat treatment group compared to placebo at 12 weeks. There was also significant improvement in NT-proBNP levels at 12 weeks in favor of Riociguat. Furthermore, there was significant improvement in WHO functional class in favor of treatment with Riociguat, shown in this slide. When we break down the hemodynamics, you can see that there was significant improvement in pulmonary artery pressure and augmentation of cardiac output with the Riociguat treatment group compared to placebo at 12 weeks. There was no significant difference noted in right atrial pressure or pulmonary capillary wedge pressure. Clinical worsening events also were statistically significant in favor of treatment with Riociguat, as shown in this slide. You see there are more events on the placebo arm compared to Riociguat, both in the 2.5 individual titration arm as well as the 1.5 milligram fixed dose arm. Of note, majority of the events were represented in the pH worsening category with pH hospitalization and the need for new pH treatment versus a hard endpoint like death. Also of note, the pH worsening events were adjudicated by a separate blinded committee reviewing all these events.
Dr. Kim talked about the adverse event profile of Riociguat.
Riociguat was generally well tolerated in this study. I think it's important to note that over 90% of patients enrolled completed the study, which is always a favorable statistic when considering tolerability. The most common side effects from Riociguat are represented in this slide, with headache and dyspepsia being the most common symptom.
And finally, we discussed the conclusions of the study and where Riociguat may fit into the treatment paradigm for PAH.
PATEN-1 study demonstrated that Riociguat is a safe, well-tolerated, and effective treatment for patients with WHO Group 1 pulmonary arterial hypertension with or without background therapy with ERA or prostacyclin. Although Riociguat represents a novel therapeutic in pulmonary arterial hypertension, we recognize that the treatment paradigm for pulmonary arterial hypertension already includes numerous therapeutics. However, I feel that this drug has an important role in the treatment of pulmonary arterial hypertension, as demonstrated by the impressive PATEN-1 study, where in 12 weeks there was significant improvement in both 6-minute walk distance as well as numerous other important clinical endpoints that were studied as secondary endpoints. Furthermore, half of the patients in the PATEN-1 study were on background therapy, and yet Riociguat appeared to improve those patients just as well as those patients who were drug naive. Therefore, I believe Riociguat will be an important addition to the already expanded treatment paradigm for pulmonary arterial hypertension.
That was Dr. Nick Kim from the University of California, San Diego. Thank you to all of the experts who contributed to this edition of Perspectives on PH. We look forward to seeing you here at PAH.TV as we cover the latest news in pulmonary hypertension.